it's easier to stay off drugs than to play the game of on and off. It's made me become the actor of my life instead of being a supporting character.
Hello and welcome to my show. My name is Rishanka Jones, and today I have with me Naila Jung. She's an independent counselor and is working in the space of alcohol use and substance use. She not only helps with treatment, but also helps with prevention and recovery programs. Welcome, Naila.
Thank you so much for having me.
Thank you so much for being on the show.
I'm a little bit nervous, but we'll see how it goes.
It's going to be great. And, this is a topic that, especially in India, is not widely spoken about or is a taboo. And I'm so excited and happy and grateful that you have taken the time out and are going to talk about it today.
Thank you. I feel there are never enough platforms for us to talk about addiction. So for you to have brought this up into the space is really wonderful.
All right. So let's start with the basics today, Naila. What is addiction?
There's great conversations and debates and writings about what addiction is, other than being a dirty word, right? You will hear that addiction is a disease. People will tell you it's a brain disorder. People will tell you it's possibly a developmental disorder. And because there are so many opinions on this, I think what for us is important today, it doesn't matter what label you're giving addiction. What nobody disagrees on is what addiction does. Addiction is compulsive behavior and the inability to control the intake of a substance. And what it does, regardless of the substance you're taking, it hijacks your brain. It changes the way you impact with the world, your reward system, your motivation system, your desire system. Imagine it is touching every aspect of your life, how you think, you feel, and you interact with the world. That's what it does. And no matter what, because of the compulsion and because of the inability to stop, despite negative consequences, right? We can see worlds falling apart. And yet, which goes back to, whatever addiction is and isn't, it definitely isn't a choice either.
We often hear about alcoholism and alcohol addiction. What are the other kind of addictions out there, like behavior addictions or other substances? Like, can you talk a little bit about that?
Yeah, absolutely. So alcoholism is alcohol use disorder.
Yeah.
Probably the most prevalent. It's also what people know about the most. In today's world, substance use disorders covers such a gamut. Marijuana addiction is on the rise.
Yeah.
Definitely with a younger population as well. Opioids, prescription medication, painkillers, you're talking about your Vicodins.
That's big in United.
Valiums, you're talking about benzos, you're talking about anti-anxiety medication, cocaine, you have amphetamines, meth. I mean, the world is literally your oyster.
Yeah.
And access is
easy now.
Absolutely.
Yeah. So these are the different kinds of addictions in terms of substances.
Yes.
What about behavior addictions?
So behavior addictions cause the same feelings in your brain in terms of motivation and reward. Okay. But behavioral addictions, we talk about gambling is probably, the most common one. Food addictions, sex addiction. We now have phone addiction. It is compulsive behavior, but not linked to the intake of a physical substance. But the reactions it's having in your brain and what it's doing to your motivation, reward, pleasure systems is all exactly the same.
So, and correct me if I'm wrong, I've heard this, that sometimes when alcoholics, in their recovery program, they've given up alcohol, they tend to get addicted to a different kind of substance, whether it's food, like sugar, or something else. Is that true? Then how do you get over that? Because then it's like one thing after the other. It's compulsive behavior.
It is compulsive behavior, right? That is why when one is in recovery, you use that term, right? Or when one is trying to give up substances, it is a lifestyle change because you are learning new habits and new behaviors. It's sugar. You mentioned sugar. That's always an easy go-to for people recovering from substances because it's making the brain chemistry work in a lot the same way.
Yeah.
And yes, can it get out of hand? Yes. Does it? Yes. Is it better than the route you're going to go down? But do we have to learn behaviors to eventually taper and temper how we are with all substances? That's a learning process.
Yeah, and I want to get to the recovery programs and what are the ways one can, work on themselves to get over this. Before we move on, you defined addiction. You talked about the different kinds of addictions. How does one know that this is a problem within themselves? Like, whether it's alcohol addiction or any other substance. And when do you think is the time to actually go out there and seek help? Because there's so much recreation drinking happening.
Absolutely.
And I'm taking the example of alcohol right
Absolutely.
now. There's a very thin line between like
And those lines are blurred now.
It is, because socially people are expected to drink. There's so much peer pressure. Even families are drinking together now, which was not the case 15 years back.
Yeah.
And I'm going to, again, talk about, nurture versus nature in detail, where family setting is such. But when do you think it is time to seek help? And what is that one or two things people should look out for?
Okay. I like that question, actually, because I always tell someone, when they're asking, about whether someone has an issue. First of all, if you're asking yourself, do I have a problem?
There probably is a problem.
There's probably something you need to look into.
Yeah.
Right?
Yeah.
But if we were to look into a picture that's a little bit bigger than that, if someone has to do a substance or take a drink, despite perhaps thinking that they shouldn't, when they're trying to control quantity of any substance and they're unable to do that, when your body is constantly physically craving a substance, when you're constantly thinking about a substance, all of these are indicators, right?
Yeah.
But they all come back to that same question, do I have a problem?
Yeah.
There's probably something there that you need to assess.
So when you're questioning yourself, that's the first indicator.
Absolutely.
Okay. And, families, friends, support groups sometimes notice these things in the person who's dealing with the problem and has not realized that it's a problem yet. What is that first step that a family member or a partner should take in highlighting this problem? Like, what is the smoothest way to talk about this?
But I was just going to say, I wish there was a smooth answer.
So for this, there isn't, but I'm you deal with so many patients on a daily basis, and I'm sure they all have different stories of how their family members or partners address this.
Yes.
Which is your favorite story? If you don't want to mention names, I understand that.
I think it's just when it comes to the family dynamic, no matter what relationship you're playing with an addict.
Yeah.
I think it's important to acknowledge that families equally suffer.
Oh, yes.
Right?
Yeah.
Addiction is not in isolation to an addict, and families suffer in multiple ways. And I think one thing for me to tell a family member is, first of all, it's not about you. I think there are people who take addiction personally. Am I doing something wrong? Is
you mean
this
the
about
family
me?
member?
Yes.
Okay.
Right? In terms of family. And I smile sometimes, and I take it's great pain when I hear a family member tell an addict, if you love me, don't. Because if it really was as simple as that, there would be no addicts, right?
Yeah.
So it's never about another person. And I think it helps in beginning the journey to know that the family member is not at fault. I think that's a good place to start, to know that you don't have anything to do with it, but neither can you be someone's savior. And for those people whose families have noticed, I say lucky them, because for so many people, their families and their friends and their loved ones ignore these things, put them on the back burner, pretend they don't happen.
Yeah.
And that's what I see most. So when we're talking about families, I see plenty of situations when, unfortunately, the families are not even in the picture.
Mm-hmm. So they're just
either
dealing
out of
with
choice
it
or
alone.
otherwise.
Wow. So, okay, let's move on to nurture versus nature. What are your thoughts on that? Like the genetic makeup versus the environmental conditions.
Yeah, I love that. That's a full whammy.
Yeah. So what do you think about, there's so many things you can blame this on.
Yes.
Your family, you can blame this on your school, your classmates.
It's always good to blame others.
It's always good to blame others. But what do you think is the true cause of addiction?
So, there are studies out there that there are certain genes that have been marked that increase a person's propensity towards addiction. It's also been seen that families have addiction in them over generations. Having said that, it works the same as, I would like to say, diabetes or heart disease. Just because it's in your family doesn't mean it's going to happen, right? Which is why, so that is the nature aspect of it. And that's when your environment comes in. Mm-hmm. And I had a patient who once really said it beautifully, and I won't take her name, but I'm going to steal it from her. And she said something in the conversation about, my genes were the gun, but my environment pulled the trigger.
Environment is the trigger.
Yeah. And she was born with a certain genetic makeup, but she's also the only sibling who has addiction in her family, right? So there's obviously multiple issues at play.
Yeah.
And that's when the environment comes in. And you were talking earlier about, access, right? Does that make a difference? Peer pressure, does that make a difference?
Trauma and abuse in your childhood.
Absolutely. One's socioeconomic status. one's level of mental health issues, all of that. And so there is no one, unfortunately, of correlation between those two, because there is one event that will snap that can or can't. So it's really a combination of nature and nurture and what we're exposed to once we have or don't have what we're given.
So do you think, Naina, that for someone who knows, like for example, okay, I know that this gene is there in my family, how can I be careful with my children and my children's children? Like, what is the advice I give my children so that I create that environment which does not trigger the gene? Are you understanding? I know there's no like final answer for this, that if you do this, this will not happen. But what are the precautions one can take?
I think that is, conversations in families is not just about precaution against addiction, but I think children definitely need to be made aware of
the gene.
Yes.
Yeah.
And what it can do. And other than that, responsible drinking should be taught to every person, right?
Yeah.
The propensity to stay away from or be attracted to drugs and the way we use them and consume them in today's world, those are conversations we should be having regardless.
Yeah. No, that makes so much sense, especially today with drinking so openly, being done. All right. So in terms of similarities, again, I'm going back to your patients. You must be talking to so many different kinds of people. But do you see a similar pattern or any kind of similarity in their stories on how their addiction basically began? That they had to turn to alcohol or drugs or any other kind of substance?
If there was one answer, I think that would make my job really easy. So I wish I did know if there was an answer. I can point to many patterns.
Like
and
what?
Yet I can point to none at all. Trauma I see, which is common. But I can't say that exists in 100% of people I see. So I think what it is more is it's about responses of individuals to environments, right? We can all be in the same environment, but our responses and reactions to what we're faced with. And those are really individual traits.
Okay. So you said trauma is one thing.
That's
that you
an example.
See. Yeah. What about mental health conditions? Do you see that people who have an underlying mental health disease turn to drug and alcohol use? Is that like an outlet for them?
Is there a relationship between addiction and mental health? Absolutely. In fact, I think it's really important to get a diagnosis on that.
Yeah.
It's very important to go to a medical professional, because for those who have addiction as well as mental health conditions, those are called co-occurring. And so even if those are to be treated through medication, they should be treated simultaneously to trying to treat addiction, right? So you're working consecutively to deal with both aspects. And, my suggestion then would, of course, be to not treat those two independently. So it has to be an integrated approach.
Of course. And, you mentioned that addiction is a compulsive disorder.
Yes.
But compulsive disorder is also a mental health
Absolutely.
disorder.
Yes.
Right? So there is like a big overlap there.
Yes, but do all people with mental health become addicts? Absolutely not. Nor is the vice versa true. But do they feed into each other? And can they be linked and just become a vicious cycle? Absolutely, they can.
Okay. So, you are working from the beginning till the end, like end to end. There's prevention, there's treatment, there's recovery, right?
Yes.
You're providing all these three services. So we spoke about prevention. You said, just having these conversations at home, talking to your children, talking to your partners. What are the treatment programs available for addicts today, especially in India?
In the context of India, I must say, unfortunately, there aren't enough, but there are absolutely more than there used to be before. We'll start off our conversation with talking about, I think, the most common and the most heard of forms of recovery from addiction are what are called 12-step recovery programs, right? People can find those in what are most commonly Alcoholics Anonymous or Narcotics Anonymous.
Okay.
Right? There are mutual help peer groups.
Okay.
Always a great place to start.
Okay.
Always a great place to be.
And there is no medication or anything involved in this. This is just communities talking about their problems.
Absolutely. 12-step recovery is peer support.
Okay.
Right? If you want to talk about medication, we have what is called medication-assisted therapy. There are people who are given medications to either completely cut off substance use, or to moderate substance use, or to have adverse consequences to your physical body were you to consume a substance while on medication.
Okay.
Right? So you have, for example, in the market, you have a camprosate, you have disulfiram, you have naltrexone, you have a bunch of stuff out there,
So these are medications for addiction, like to overcome your addiction problem?
So overcoming would not be the wrong word, but are they meant
curb it.
to curb it?
Yeah.
Yes, there are medications in the
Wow.
market for that.
Okay.
So they are medication assisted therapies. It's always great to, of course, do that with a medical practitioner.
Yeah.
And again, even if one was to do medication assisted treatment, I would highly recommend that people also go for evidence-based practices, behavioral recovery, right? Talking about today, the buzzword is CBT, cognitive behavior therapy.
Yeah.
You know, I would suggest even was someone to take medication or look into that. They should absolutely do it in tandem with other therapies such as that. There is moderation management, for example, for people with alcohol use disorders.
Okay. What is that? Can you talk a little bit about that?
So if we were to talk about 12-step recovery, that is 100% abstinence from drugs or drinking. Moderation management is what the name says. You try and moderate what you're having. So in terms of what is available, a great therapist is always a good place to start. You have treatment facilities out there that can help both for rehabilitation and for detoxification. And, there is no one model fits all. Some people try a bunch of these therapies altogether. And for some, it's one. And I always say this, and before this, we were chatting as well, whatever rocks your boat.
Yeah.
And you've really got to find it.
What works for you?
Absolutely.
But I think a lot of people in India, especially, are not aware of what's out there, what help is available. So if I were to just summarize what you said, in terms of help that's available, one is, of course, your extreme 12-step where there's complete abstinence, right? So let's start with the beginning. There's moderation therapy where you can start slowly. Then there's going to therapists. There's CBT. There is
DBT, dialectic behavior therapy, which is similar.
And then there's your extreme, the 12-step program where there's complete abstinence, right?
Yes.
Do you mind talking a little bit about the rehab centers that are there in India? Not one specifically, but what does a rehab center do? Is it like 100% abstinence from the substance? And are they like detoxing you? I'm sure every rehab center has a different program, right? But just generally, I'm asking because, people, when they hear of rehab center, there's a very negative, you start thinking like, oh my God, is my child or my spouse like going to be treated with needles and what's going to happen there?
Yeah. I think what people should know more about is, what is a rehabilitation center meant to be?
Yeah.
It's meant to do exactly that. It's meant to rehabilitate. And I think that that's sometimes forgotten even in the rehab centers that run currently. Some of them, do they have detox facilities? Absolutely. But for detox, one can also go to regular hospitals. Hospitals are also available for detox.
What is detox? Is it like, do they just flush out your entire body, like everything you've taken?
It's very dangerous to try and get off a substance alone immediately.
Okay.
And so detoxes are ways to make things kinder for your body.
Okay.
To ease you into the process of getting drugs and alcohol out of your system.
Okay. And I'm sure there's like a whole clinical side to this whole process, right?
So I think a rehab has a negative connotation, sometimes because, we just don't have enough good ones, but sometimes because I think we forget that the purpose is to rehabilitate. And if one was to rehabilitate someone suffering with issues of addiction, to be able to integrate them back into the world and into society, what a wonderful thing that is.
Yeah.
Yeah.
Definitely. No, thank you for that. I've heard about relapse so much. What is that all about? What are the triggers?
Relapses are sadly, too frequent for many people. And a relapse is when you've been abstinent for some time from your drug of choice, whatever that may be, and you go back to consuming that drug. Often, it starts off with a simple, your mind tells you, maybe I can stop at one. And sometimes it's because you don't want to stop. But the relapse is going back. And I wouldn't necessarily say to the drug of your choice. There are people who use other drugs than what would have been their preferred method. But I've seen that it will always end up with them going back to their drug of choice.
Is it harder to get out of that phase or that, that relapse state? Like this, because this would be the second time you're going to try to get out of your addiction, right? How do you do that? How do you get out of it?
If it was only a second time, I think that would be easy. Unfortunately, once the wheel is in motion, it gets tougher and tougher. And sometimes I want to tell people struggling with addiction, that it's easier to stay off drugs than to play the game of on and off. And I don't say that flippantly at all. It's equally hard, but I see too often that the more relapses people have, the more they seem to lose faith in themselves. I think that that's what sadly begins to happen.
So do you have any strategies for people, when they come to you that, okay, I've had a relapse, like how do you get them back on track? What is that? Is there some kind of talk therapy that you do with them that encourages them, brings their confidence back up, motivation back up, that, I have to go clean, I have to get clean?
I think these are things that, I'm working with people on constantly, on the back of someone's relapse. I think it's very important to be kind, but to yet be tough. And you don't want to mollycoddle, but you don't want to isolate. And that's always a really thin line.
It is.
And I feel as, a therapist and a counselor, it's your job to put out your hand and hopefully for your client to take it back and hold it.
All right. So, Naila, you have been sober for many years now. You've had your own journey and phase of life.
I have, yes.
You had an addiction. What was your breaking point that you decided to seek help? And I just feel like you were very strong to actually go out there and seek help. Not many people realize it, and even if they do, they don't have the courage to do it. That's why I'm asking, what inspired you to actually go out there and seek help?
I'm always so, taken aback when I get on this journey about myself. Yeah, I'm very blessed to have been sober and from my drugs of choice for a while now. And I have to say that I was really one of the lucky few. And by that, I mean my family figured things out for me a lot sooner than I did. I would say that I was quite unaware that I had addiction would be a faraway word that I would never even have used. I was even unaware I had a problem.
And I think that's 90% of the people these
I see
days.
it a lot.
Yeah. They don't think it's a problem. They just think it's like recreational drinking or use of whatever substance.
Yes.
Yeah.
I didn't think it was a problem. I didn't think I was being problematic. In hindsight, I call it luck. I didn't see it quite that way when it happened. My family had an intervention.
Well, that's nice. Okay.
And I was made to address certain issues. And that doesn't mean it was easy. I didn't go into the light immediately. It was really difficult and it was a struggle. I had to find my own balance of what was working when we go back to what else is out there. And I myself use different methods of recovery.
Okay.
Like I said, no one size fits all.
Sure.
And it's taken me some time to find this balance. And it's an everyday journey.
It is an everyday journey,
Yeah.
but it's great to know that your family kind of figured it out before you did, and they had this intervention for you. So that's one great way. If you feel like your family member or partner is struggling, an intervention is something maybe that you could start with.
And maybe I should thank my family. Never give them enough credit.
Nobody does.
And I must say that I wasn't very fond of them when the intervention happened.
Of course.
But looking back, it really was the greatest gift. So I look back at it fondly.
Yeah.
I don't remember it quite the same way when it happened.
So, Naila, firstly, thank you so much for sharing that very, very personal part of your life with us today. I know it's not easy.
But it's imperative and necessary for us to
be spoken about.
Yes.
I think so. Because everybody takes it very lightly. Any kind of alcohol use.
I wish I knew more people were suffering from addiction when I was looking for help.
Yeah.
I wish I knew where to go, who to talk to. I now hope to be that person for some people. Yeah. But that's why conversations like this are so important. There can never be enough resources for someone to find help.
And I think for someone who's been through it, like yourself, who's been through this journey, be able to help people better because you know what they're going through internally, right?
I think there's a level of understanding, absolutely.
Yeah, there is a level of I know yours was not that extreme, or your parents got ahead of it way before, but still you have a sense of what's going on in the mind and in the body in terms of compulsive behavior.
Does it make a difference when I am talking to someone who has been through what I have been through? Yeah. I know it's not patronizing. I know it comes from a place of honesty, and I know it comes from lived experience. Nothing can beat those things, really, right?
What does it mean to you to be sober? How has life changed since?
I think, we started off our conversation in much the same way in what I'm going to address now, which is, when I was going through my struggles, I had lost the ability to have motivation, reward, pleasure, function in so many ways. And I never saw that. And I think what being in recovery has done for me is it's made me become the actor of my life instead of being a supporting character. I don't know how else to put it. It's that I'm actually an active participant versus being a passive watcher of my life. And that doesn't mean it's all good. Absolutely not. Do we all have bad days? Yes. Can I go through those times, whether they're good or bad, in ways that I didn't even know I could? Yes.
That's such a beautiful line that you've said, that I'm an actor, not a supporting role. When you say that, do you, and I've noticed this with people who are in recovery. I've done a podcast with someone else also. He just seemed like the most mindful, spiritual person I've met in a while. So do you feel that people who are, whether it's in recovery or have recovered, do you think they're more mindful of their actions just generally in life? They're more mindful, they're more spiritual, they're just like really present in the moment.
I think it's important for people to practice conscious living. And you use the word spiritual, and I think today that word is thrown around in so many different contexts.
Yes.
And to me, to be a spiritual person, or to say, is actually pretty simple. It's someone who is in touch with my spirit. It's what's inside. That's what was missing for so long. So I think when you say that someone who seems spiritual, I think it means that they are just maybe more in touch with who they are and what they represent and who they want to be. And because they are sober.
So to end things, Naila, that was such a fantastic conversation. What advice would you give someone who's struggling with an addiction, or who thinks they may have an addiction and feeling hopeless and lonely?
So I really do want to tell everyone out there who is struggling with addiction in any which way, what form, you are not alone. I think it's really important for people to know that, because people feel alone and isolated, and then help becomes difficult because you're alone and in isolation. And it is not about you. It is not a morality issue. It is not an issue of stigma. It is not an issue of shame. And you are not alone. And I want everyone to know that, yes, addiction is not curable, but it is treatable.
It's treatable.
And help is out there. And as much as with everything in life, when we have people, it just makes it so much more bearable and easy.
So building a community, as somebody told me in one of my podcasts, that invest in relationships.
Absolutely.
Have those one or two people in your life who will correct you when you're wrong and stand up for you when you're right.
And you need a handful.
Yeah.
You can count them off on the palm of one hand, and that is more than enough. I think, unfortunately,
it's hard to even find that these days.
Yes.
And Naila, what is one piece of advice you would give the family members and the support groups? Because like you said, that they are suffering too, right?
Absolutely.
And even though one should not take it personally and one should, not judge, it's very hard as a family member to be present and yet distance yourself.
Absolutely. It's a Herculean task.
It's really difficult.
It is really an impossible job to be a family member or a loved one of someone going through addiction. I do want to say that. I have seen that firsthand. And I want to tell families the same things that I would probably just have told the addict, which is, you're not alone. And as much as for the person with an addiction, help yourself. Find a therapist, learn about addiction. Start with individual therapy. I've seen that always work for family as well. It gives them a really
good outlet.
Yes, an understanding of what they're going through without making it personal. The picture is so much bigger and so much larger that the best way to equip everyone, is to help myself, get a therapist, find out about addiction. There are self-help groups for people.
That's what I was going to ask you, similar to what you spoke about for addicts. You said there's AA, there's NA, there's all of that. Is there anything for family members as well?
Yes, actually, you can find 12-step programs for family members of those with addiction as well, if you go out there and look for them. Yeah. Those are very much available. Okay. And also an underutilized tool. So
yeah, like I didn't know that there was one for family members.
Absolutely.
All right, Naila. So to end things, finally, I know this has been a long conversation, but What is the most important message you want the listeners to take from our conversation today?
The most important message, it happens, but the question is now what? And I think we started off with what is addiction. And if people have come to a better understanding, the conversation can now shift to now what?
Now what? How do we help?
Absolutely.
Yourself or
another.
Thank you so much, Naila. This has been such a fantastic conversation.
Thank you so much for having me. I was a little bit nervous, but
no, I know we've spent 2 months trying to schedule this.
We really have.
And
I
am
apologize.
so grateful that I finally have you here. We have the setup and we were able to do this.
Thank you.
So thank you once again.